A Bentall procedure is a cardiac surgery operation involving composite graft replacement of the aortic valve, aortic root, and ascending aorta, with reimplantation of the coronary arteries into the graft. This operation is used to treat combined aortic valve and ascending aorta disease, including lesions associated with Marfan syndrome. The Bentall procedure was first described in 1968 by Hugh Bentall and Anthony de Bono. Alternatives. The Bentall operation entails replacement of the aortic valve, aortic root, and ascending aorta, but other operations may be used when all three components are not involved. Normal aortic root. The reimplantation of the coronary arteries is prone to complications, and aortic root replacement should be avoided when possible. The aortic valve and ascending aorta can be replaced in separate steps, without root replacement. Normal aortic valve with annular dilation and ascending aneurysm, frequently found in Marfan syndrome. Artificial heart valves may wear out or require anticoagulation, and a valve-sparing aortic root replacement allows replacement of the aortic root plus/ascending aorta, while allowing a person to keep their own aortic valve and avoid the problems of aortic valve replacement.
Please subscribe and thanks for watching.